fans of former talk show host Wendy Williams are showing their support for her after she revealed that she's been diagnosed with frontotemporal dementia and aphasia. Aphasia is a condition that impacts communication and language. Frontotemporal dementia impacts behavior and cognitive function. Representatives for Williams say this diagnosis has presented, quote, significant hurdles in her life. Actor Bruce Willis also suffers from these diseases. He was diagnosed with aphasia in 2022. His family said last year the condition had progressed to frontotemporal dementia. We want to bring in Sandra Weintraub now. She's a neuropsychologist for Northwestern University's Mesolum Center for Cognitive Neurology and Alzheimer's Disease. She's also a professor of psychiatry and behavioral sciences. Thank you for being here. Talk to us just first of all about the symptoms of these diseases and how difficult it is to diagnose.
Yes, so frontotemporal dementia is a group of conditions in which a person experiences either personality change or can also experience aphasia or just aphasia and not personality changes. And these diseases progress because they're due to neurodegenerative disease in the brain. But the symptoms can differ from one individual to another.
And talk to us about how it's diagnosed. And more specifically, we understand that that this is likely a condition that is underdiagnosed because it presents certain challenges.
Yes, it's very much underdiagnosed, both primary progressive aphasia and the behavioral variant of frontotemporal dementia. One thinks of a dementia usually associated with older individuals, and one thinks of memory loss, sort of the kind of dementia that we most often associate with Alzheimer's disease. But these dementias that present with loss of language or changes in personality are so puzzling because you just assume that must be some kind of a psychiatric illness, or maybe the patient had a stroke. And so the initial diagnosis of these progressive dementia illnesses is very, very difficult. And so I'm a clinician as well, and I've seen people get 3 or 4 different diagnoses before we arrive at the final one.
Well, talk to us also about the disparities linking to diagnosing these diseases, because we've now heard from 2 celebrities who are suffering from these conditions. But for our viewers who don't have celebrity or wealth, what should they do if they suspect that maybe one of their loved ones is suffering?
Yeah, I think that what we need is a major public health education campaign to make people aware of the fact that just because you're getting older doesn't mean that you're going to necessarily lose your memory or lose other abilities. And that when people see these changes that are so puzzling, for example, becoming very disinhibited or not behaving well in public, should say to themselves, well, maybe this is a personality issue, but maybe there's also a disease underlying this. And as we know that people, as they get older, are much more at risk for developing these neurodegenerative brain diseases.
I think that's such an important point, because a lot of times people with their conditions are just written off, particularly just as that's part of aging. Does early intervention, does early diagnosis have positive effects? Is it very important to try and increase that public awareness so that people can be treated and that improves outcomes?
Yeah, it's critical. The neurodegenerative brain diseases really don't have any effective pharmacologic treatments yet that can stop the diseases or reverse them. So one of the major things that we can do as clinicians and as researchers is to work with individuals who are affected and to help them have quality of life and work with the people who support them, their care partners, their friends, to help them to be more effective in their daily life while they're living with these symptoms.
All right, Dr. Sandra Weintraub, thank you.
Welcome.